What's the secret to glowing, youthful skin? Injectable hydration treatments might just be the answer, and they're changing how we approach facial rejuvenation. But what makes these treatments so special, and are they right for everyone? Today, we're uncovering the science, the benefits, and what you need to know before booking your next appointment. Stick around, you won't want to miss this episode.
Welcome to The Doc Dudes, your premier podcast for a behind-the-scenes look at the latest in aesthetic medicine. Hosted by the cosmetic surgeons at Graper Harper Cosmetic Surgery in Charlotte, North Carolina, The Doc Dudes brings you interviews with insightful guests, expert tips from experienced medical professionals, and lots of laughs along the way. And now, here's Dr. Garrett Harper, Dr. Robert Graper, and Dr. Evan Zug, also known as The Doc Dudes.
Welcome to The Doc Dudes, another episode. I'm Garrett Harper, along with my fellow physician plastic surgeons, Dr.
Robert Graper.
Bam, and Dr.
Evan Zug.
Well, we have some special guests today. We have two of our aesthetic injectors. Linda Owens is an aesthetic injector here at Graper Harper Cosmetic Surgery, as well as a national trainer and educator for Allergan Medical Institute. We also have Kristen Hall, another one of our premier aesthetic injectors, and our in-office specialist in PRP, PRF hair restoration, and eye treatments, plus a new treatment that we're going to be talking about today, right? So we also have a third injector who's not with us around this oval table that we've got in here right now, Terry Trudnak. She's also one of our aesthetic injectors as well. But today, we are specifically going to be talking about injectable hydration. We'll also go over all the other injectable solutions that we have for facial rejuvenation. But we want to spend a little bit of time on a new product that we've been using. Geez, I'll let the girls answer this. I feel like it's within a year. Maybe it's been longer than that. I don't know. It's called Skin Vive. So welcome, Linda and Kristen. Thanks for joining us. Yeah, hey, good to see you guys.
Hey.
So I remember when this was first coming out, my wife was really angry that I didn't let her know and that she wasn't one of the guinea pigs that came in. So it's etched in my brain. But tell us a little bit about Skin Vive, what it is, and where you can use this product. So Linda, Kristen, you both kind of can talk, but what do you think?
So Skin Vive is the first ever and only FDA-approved hyaluronic acid gel that hydrates the skin. It's a skin booster. It's not a filler. You know, we have a toolbox of fillers in our Juvederm collection. So this does not fill, but it's injected right into the dermis. And
so for our patients, when you inject cheek, when you inject temporal hollows, when you inject any of those marionette lines, nasolabial folds, lips, any of that kind of stuff, that's not being injected in the skin?
that's injected just under the skin typically, or supraperiosteal, which means right on top of the bone, depending on the product and depending on the results that you're wanting, whether you're wanting to feather a little bit or to build and uplift.
Right. And you say hyaluronic acid, that's a natural product. Our body makes hyaluronic acid, right? So so this is, and the other Juvederms that we use, those products, those Volbella, Voluma, those are all hyaluronic acid based as well, right?
They are.
So this is just a different kind of consistency of it?
Yes, they all of the Juvederms have different characteristics, different properties, depending on what we want to do with them and where we place them.
Yeah.
The Skin Vive,
it's really hydration. It's really looking at your face as a little dehydrated. And then when we add the Skin Vive, it rehydrates.
Okay.
So it doesn't fill, but it does give a nice bounce, softness, glow to the skin.
It's injected in the skin.
Yes. More superficial than our other fillers.
And so I'm thinking just like 1 million needles. Like, how does this get injected? Are you treating a particular? Are you treating a particular area? Like, are you like, oh, let's do this to under the eyes, or let's do this to around the mouth, or is it like a total kind of? Look, buckle in, bite down on this wooden spoon. We're getting ready to do the whole face.
You know, it's FDA approved for the cheek area, extending down to the jawline. But we know that we can safely also inject it other areas. For instance, the perioral lines, the lines above and around the mouth. Those are areas that really are pesky to so many people. It's a big concern.
Sure.
And where we don't want to inflate that area and to make it look abnormal or not
Full.
attractive or full, we want to just soften those little lines. Again, it doesn't fill them, but a lot of those issues are due to lack of hydration. And as we age, we don't make as much hyaluronic acid. So we do see those textural
And so this
changes.
is kind of hydrophilic, and it kind of helps basically the skin look more hydrated because it's pulling fluid into that area. Is that right?
It works on the little aquaporins, the proteins that uplift, open the gate for hydration to the skin. And that's how it gives you that glow.
Yeah, so that's kind of their tagline, right? That like enhanced skin hydration, smoother texture, and a natural glow, right? So,
And if you didn't want to put filler in your lips,
yeah,
we do a lot for hydration in the lips.
sure.
So
beautiful.
it just hydrates. It doesn't give you any fullness, but it just puffs out some of those,
Yeah.
the little wrinkle lines that you have. It's great.
Help me understand. Volume would efface these wrinkles with the filler, but this hydration will efface them as well without making them bigger. Is that right?
Yes, won't last as long either. Will last about 6 months.
Okay. And some of the other fillers are a year to 18 months, sometimes 2 years for some of those fillers, right? But this isn't somebody who's like, they may love their facial anatomy. They may really, their bone structure or additional filler that you all have placed for them correctly, they may absolutely love the way the shape of their face is and where the volume is. But this is specifically
A
to have
hydrator.
them just look more hydrated. Wow, that's wild.
It's so amazing. We have all seen so many changes. We're always on the cutting edge of the new availabilities in surgery and skincare and injectables. And we love learning about new products and using them. Almost everyone in our office has had all of these products, has had the Skin Vive, except for your wife. Next time, let's don't let that happen. Let's let Kristen be the
Yeah,
first.
she was not happy. She's like, what in the world? Why am I not
But
the
it's
one that
even for
gets-"
men. We just
Yeah.
did Dr. Zoo.
I was about to bring him in.
And what
I
does
was
he say?
about to bring him in.
I'm 4 weeks post treatment.
Yeah.
And
You look like a different guy.
You do.
You look so much younger.
He does.
I don't.
Baby
does.
face.
I have noticed a difference. Going from someone who never even paid attention to my skin,
Right.
and now being here and learning about all these things and using an HA, any of the HA products at night or in the morning, I've noticed a difference. And then when we did this, I really started to notice how just brighter, softer, kind of the area that we treated has been. And it's not painful. It's not any worse than Botox.
Wow.
We do numb. We
Yeah.
numb
I
everybody.
was about to ask you, like, walk me through if I'm a patient and you're like, oh, you want to have more hydrated looking skin and for a longer period of time and improve your texture. You're a great Skin Vive candidate. What happens to that patient?
We numb them.
Okay.
We numb them for a little bit.
And so when you say numb, you mean a cream?
Yep,
you mean
topical.
like, okay, all right.
topical.
Okay.
We do that. And then the injections, there's a lot of them, but
Yeah.
I think it's people get used to it.
Yeah.
And there's also numbing in the product. So
There's
as we go,
lidocaine in the juvenile products. So yes, as you get injected, you do start getting numb, and it is different from the other fillers. You do not see results right away.
Right.
You see results in about 2 to 3 weeks,
Okay.
and it's actually not something that you would take a before and after picture and go, oh my gosh, what a difference! Like we see when we are creating structural differences and fixing deflated lips or cheeks. But it's
Well,
something
cameras can perceive volume corrections and things like that, right? But it's going to be a lot harder to actually look at the hydration status. I mean, I presume you could probably have some fancy camera that like looks at hydration. I don't know how it would do that.
Is it is it a replacement for a daily HA serum, or do you guys still recommend using your?
in conjunction
Yeah.
with the topical treatments. And what most of our patients, the feedback that we're getting is similar to yours, Dr. Zug, in that, you do see a hydrated look, a glow. Our patients, I know that you don't wear makeup, but our makeup wearing patients. Well, yeah.
That's up for debate. That's up for debate.
He doesn't have it on today.
Yeah, nobody looks that good without makeup.
Right.
Come on now. Yeah.
But I have noticed my forehead is more dry. it's probably because
we didn't treat your Kristen didn't treat your forehead.
my cheeks have the skin V.
And it helps with the texture and the pore size.
Yeah.
So sometimes when we do the picture, when we want to take an after picture, we can see the pore size is smaller.
So when is maximum benefit, right? Because you guys have to, like, a lot of
4
times
weeks.
with your stuff, whether it's Botox, whether it's filler, whether it's this new Skin Vive, you've got a patient that comes in and says, I've got a wedding that I'm in, I've got a reunion, I've got whatever they've got, photo shoot, whatever, all these different patients. Court appearance. That's exactly right. You never know. That's pretty good. Yeah, I'm being featured on Dateline. So how do you time this? 4 weeks is what you tell the patient.
4 weeks, and it's going to last you about 6 months.
Okay.
So if you've got something going on, you want to get your Botox and Skin Vive good 4 weeks before you do it for maximum benefit.
So go ahead.
Can you do this in conjunction with the other fillers where,
Absolutely.
okay, the face is already numbed up? Tell us about that, please.
Yeah, it's it only takes a handful of extra minutes to do it. So we realize our patients' time is very valuable. So it is not a lengthy procedure. And while they're in our chair getting their, even if they're just getting Botox, we can do their Skin Vive treatment as well. And there are fillers also. So it takes maybe 10 minutes extra.
So talking about fillers, what a great segue, right? Because I think this is great. I'm going to go back and forth between you two, since you're the experts, because Dr. Zook and Dr. Graper and I think we know this, but we don't. And I'm going to name a filler, and you tell me your favorite place to put it in the human body. Ready? All right.
Ooh, dangerous.
Let's keep it PG-13. All right. Linda, Voluma. Who's a good patient? Where anatomically would you put Voluma in the patient?
Voluma was the first Vycross product that came out. It was first FDA approved for the midface, for the cheeks. Now it is also FDA approved for the chin and for the temples.
Okay.
So a good candidate is someone who, maybe they've got wonderful cheekbones, but then the cheek pads have deflated as we age. Our fat pads not only get smaller, they deflate, but they also descend. The ligaments stretch a bit like an overused rubber band. We can't do anything with that fat pad except for reestablish it. And so in the midface, it will actually give you somewhat of a lift and some more definition to that area. Temples, it's rare for someone to come in and say, I've got this hollowing of my temples.
I think that's highly undervalued and underdiagnosed.
The temples get forgotten.
Amazingly.
100% agree.
Amazingly.
Yeah.
And
that really ages somebody.
It ages.
I think you've got very attractive temples myself.
Thank you. I appreciate that.
I think all of y'all
I know.
have pretty amazing
I know.
temples. But when you get to the point where they're a little deflated, we can fix them. So that's a good candidate. And then also someone who's got a little bit of a retrusive chin, maybe the beginning of jowling, and they're not quite ready for their facelift.
So somebody that's weak chin.
Little weak chin.
We'll go to the jawline here in a second. Hold on now, right?
Okay, that was mine.
That's
That
right.
was
There you go.
Voluma.
All right.
Pick on Kristen
Kristen, how about velour? What is velour and who is that a patient
That's
for?
our favorite, and I think it is, isn't it? We
I
say
call velour my Frank's hot sauce.
Yes.
I put that stuff everywhere.
Very alluring.
Yeah,
Yes,
that's right.
it is. It's like butter. And so
Okay.
there isn't a patient that really isn't a good candidate for it because we can find places for it. It's good in the folds around the mouth. It's delicious in the lips. We love it.
Okay.
In the chin shadowing, we love it.
Like the marionette lines kind of
Marionette
stuff.
lines, oral commissures.
So velour is like a jack of all trades.
Yes. It's not going to give you volume,
Okay.
but it's going to soften out some of the deeper lines.
Gotcha.
And you
In
can
places you're not, because you don't want like big hunking nasolabial folds.
No.
or
We
big
want to
hunking
trade
marionette lines.
shadows
That's
for
right.
light.
Yes.
Okay.
How long do these things last? The Voluma and the
Voluma is FDA approved for 2 years.
Wow.
Velour is FDA approved for 18 months.
Okay. All right. Linda, next one. Volbella.
Volbella is not as robust as velour or Voluma. It's a little thinner, and it is for the lips, for that person who hears us say, should we do a little bit in your lips? And they get really frightened because they've seen good lips gone bad.
Sure.
But
Not from here.
Not from here.
Not from here.
But as we age, our lips get smaller. They get a little curled inward.
Speak for yourself.
Well, where'd those lips go? We can fix those, Dr. Graper.
It's just because he's lost all his teeth. Everything just kind of rotates inward.
We can't fix those, but we can give you some lips.
Right.
But Volbella's going to look soft and smooth and pretty without looking big and full. And it's also great for the infraorbital hollows, which are the tear troughs.
Okay. And then what about Volux?
All right, so Volux is our powerhouse for the jawline.
Okay.
We can also use Voluma. We've done that for years, putting Voluma in the jawline and in the chin. And now,
So can I stop mewing and I can just come in and get Volux in my... Do you know what mewing is? Oh, you got to look it up. You'll love it. So I've got teenagers, so I know what mewing
I
is.
started a new one today.
So it's this like thing...
FML.
It's...
I thought it was a steroid drop, but it turns out it's not. I just heard that today.
Yeah. So mewing are exercises that people are doing to try to chisel out their jawline. And it's like, I can't believe that that's a real thing.
Wow.
Mewing.
You?
Oh, have you seen those? It's
Can
like
you
a
show
ball that you put
Oh,
in your mouth. Just
absolutely. Yeah. And that
Strengthen.
like your masseters get all that kind
Yeah.
of stuff. But I mean, it's so funny. Mewing.
Well, darn it. There goes our practice, right?
I know, right? Well, that's what I'm saying. Can I stop and just come in and take it the easy way?
Take it the
It's
easy
like
way.
liposuction. I don't want to go to the gym. Just suck it out.
That's right.
Right? Jeez. All right. And then Ultra and Ultra Plus have been around for a long, long time. So we kind of know what those are for, which is great. So you've talked about the different places where we can treat with the different products. Talk to us a little bit, Kristen, about PDGF.
I saw this before we move on. I saw this story. I think it was on Instagram about the surge in the male jawline.
Yeah.
And the masculine jawline
Yep.
is in.
Yeah.
And
Volux is beautiful in males and females, but really, when you look at before and after pictures, it takes a good-looking guy, maybe with a little baby face, and then you sharpen that jawline, and it takes them from baby face to
Robert Redford.
mass. Well,
Yeah.
It's just a
I guess it's
chiseled.
getting more
Speaking of
popular.
jawlines,
It is more
just
popular.
funny story before we get to the next one. Speaking of jawlines, so we went skiing up in Deer Valley, and my wife's well, she doesn't listen to these podcasts, so I can say whatever I want. But we were there at the same time as Maria Shriver and Chris Pratt, who's basically a friend. I don't know why we didn't exchange numbers, but we didn't. But
Because you wouldn't give him yours.
right? Oh man, we chatted every day. Oh, so great. But we're sitting there because he's married to one of the Schwarzenegger kids, and like Maria Shriver, we're just kind of sitting there, and I'm just acting like I don't know who she is, or like I wasn't obsessed with Arnold Schwarzenegger back in the 1990s.
Were you trying to get a selfie without anybody
No,
noticing?
I was just like, where are you guys from? You know, all this kind of stuff. But you talk about Robert Redford's jawline. Maria Shriver was certainly known for her jawline as well, right? Yeah. I mean, probably more square than most women want, but you can definitely help correct, right? Weak jaws, right? Which is, not attractive.
Well, it wasn't that many decades ago that the only way to treat that was with that surgical approach that was, so hard, difficult
Barbaric.
to go through, to advance that jawline.
Super
and now,
hard.
In less than 45 minutes, we can establish that beautiful jawline.
One treatment.
One treatment, we'll start their treatment, and it's going to look beautiful when they leave. But absolutely, next time they come in for their Botox in a few months, we'll evaluate, do another facial
you need to
assessment, see if
build
we need
on
to
it.
build on it.
Yeah, that's awesome. Kristen, talk to us a little bit about the PDGF treatments, the platelet-derived growth factor, and where are you using this? Is this just for hair restoration? I mean, obviously, PDGF has been used all over the body in different kind of disciplines and things like that.
It's been around for about 15 years,
Sure.
and they have used it in diabetic wound care, oral surgery, orthopedic surgery, and so it's just come to the aesthetic market about a year ago. And so we are using it for hair restoration. We're also doing it under the eyes because it can help. The concept is that it will help stimulate growth factors, stem cells, keratin, all that stuff.
So I've had a bunch of friends, maybe my wife, but a bunch of people that have told me that they felt like they have gotten a better result from using the PDGF underneath their eyes than filler. I don't know if they think it's just more subtle or it's doing what they're wanting it to. Because I've told people, you've got to be, the under eye filler is one of those areas, and I know you guys are the best in the business, but like to the patients out there, A, you got to be a good candidate, and B, you don't want to overdo that area. I mean, you start getting some funky looking eyes, and like similar to, you know, the not actually like the lip, but like the upper mouth area or the nasolabial folds. When people completely get rid of that shadow and efface that, I mean, it starts to look simian, like
Not
monkey-like. It just doesn't look natural. And that's where, like, you know, I was Jennifer Aniston, like just always drop dead gorgeous, amazing. I saw pictures of her a couple months ago where obviously somebody went a little hog wild on her.
Zellweger.
Oh yeah.
Oh yeah, another good. Yeah. Renee Zellweger.
And it's okay to say no.
I feel like people come in when they're talking about the eye area. It's a multitude of things. It's
Right.
not just a hollowness. It's the shadowing under. You know, the skin is so delicate and thin there, so
Sure.
the vessels make a shadow. You know, that you see of the skin.
Yeah.
And so with the PDGF, you know, it can help hydrate that area to get some of those fine lines and wrinkles. It's going to thicken up the skin there.
Yeah.
If you have a true trough, then we're going to put filler there
Yeah.
after we've addressed the
Sure.
volume loss in the cheek.
Sure.
So it was a multifaceted.
Well, I also feel like
thing that we need to do.
people's eye positioning within their skull, I know that's a little morbid to think about, is just different. And people have different shaped eye sockets. They have different apertures and sizes to their eyes. And so it's not just it needs to be really tailored to the patient, because some people just have more hollow in their eye areas. And so, you know, you build that up a whole lot. They ain't looking like a better version of themselves. They're looking like somebody completely different. I think everybody normally alludes to like Kenny Rogers when you start talking about like eye changes in people and how it's just like, whoa, what's going on here?
And it's important to study and to address their anatomy, because we all know anatomy, but everyone's anatomy is a little different. And while we want to listen to our patients and listen to their concerns, a lot of the treatment that's needed is treating an area different from the concern or the problem that they were pointing to. For instance, they come in for their tear troughs or their folds. Well, the first area to treat is the mid-face to support those two areas. So I think that's why full face assessment and knowing the right products, the right placement is so important.
Yeah, and I just want to touch on one thing before we kind of end this podcast. I think the importance of credentialing, just like you credential your plastic surgeon, right? You want to, reputation of the providers paramount to everything, right? Like certainly there are people who are younger plastic surgeons who can operate like crazy and get far better results than somebody that's been doing it for 30 years. I don't pretend to say that, you know, the new kid on the block can't be better than the old kid on the block, but I do think that what worries me is sometimes when I'm in the hospital and I'm operating there, you'll get some nurses, some nurse practitioners, somebody in there who have never done a day of cosmetic injectables in their life, right? And they're like, oh, this other nurse and I we're gonna open up our own kind of and
I just start
popular
IVs
now.
so I can inject
right.
filler.
And I just can't believe that people think it's that easy, or that it's just you can make so much money doing this, yada yada yada, and all this. And I'm tired of coming in at 7 o'clock every morning and operating and doing that. I want something easier, and it's wildly inappropriate for these people to open up shop without the proper training, without the proper credentialing. You guys have been doing this for a long time, and you're all three of you looked at as experts in this field. I mean, so much that, you know, you guys get asked to train people on how to do this. Doctors, and I tell people when they come in, you know, I'll get the occasional patient that says, I really don't, I want an MD. I want a doctor to do my injection.
So you want a worse result?
That's what I tell them. That's what I tell them. Like, you don't want me to do that. Like, that would be a really bad problem. And I always do the analogy of like a great restaurant, you know, like your favorite restaurant. You've got the chef back there making your meals, and you've got your bartender, mixologist that's going to make you the best tasting, drink that you can have. And I'm like, you don't want to cross-reference those guys. You want the people who do it all day, every day, have made a career out of it, and are as busy and successful as the two of y'all are. And so I commend you. I mean, you guys are always going to seminars and going to continuing medical education and cadaver labs and all this kind of stuff to be up with the new trend and be the safest that you possibly can. And I've always said that the surgeons at Graper Harper Cosmetic Surgery, I like to think that we're pretty great, but there's no doubt that the nurse injectors and the estheticians are what makes this place run and really kind of carries us with the quality of work you guys do. It's amazing.
Thank you.
Yeah, I can't tell you how many people of my friends just shudder because they always kind of reference terrible Hollywood stuff gone wrong. And I'm like, you ain't going to get that here. Even if it's a facelift with Dr. Graper, I'm like...
Even.
That was a beautiful one yesterday. Hopefully a good one tomorrow too, right? Mm-hmm. But in any event, if you're interested in injectables, call or visit our website, g8surgery.com, to request an appointment with one of these fine individuals. You will not see anybody better, I dare say, in the country, certainly in North Carolina, Charlotte, or kind of the region. It's not to say that there aren't great people out there also doing it besides the people under this roof. There are, but you just want to make sure that they're great. And if you don't know, you can
And passionate
DM
about
me or text me or something like
passionate
that.
about
I'll let
what
you
we
know.
do.
That's exactly
Not in it
right.
for
Yeah.
the wrong
Well,
reason.
thank you very much.
Thank
If you've
you.
got questions or topics you'd like us to cover, visit g8surgery.com. Click on the Doc Dudes from the homepage. There's a link to click to submit your questions and ideas. Subscribe to the Doc Dudes so you never miss an episode. New episodes drop the last Tuesday of each month. You'll find us on Apple, Spotify, YouTube, anywhere you listen to your favorite podcasts, as well as our website. Follow us on Instagram and Facebook to find out when new episodes drop and other information about our practice. This is Dr. Garrett Harper signing out for Dr.
Robert Graper.
and Dr.
Evan Zug.
And then our two beautiful and talented aesthetic injectors named
Linda Owens.
and
Kristen Hall.
thank you so much, and we'll see you on the next episode of Doc Dudes.